Namaste.
गुड इवनिंग सर।
Namaste, madam.
नमस्ते सर।
Good evening, sir. Good evening, ma'am.
गुड
Namaste,
इवनिंग।
madam.
Good evening.
Good evening. I am Simran Thakur. I am a second year MBA student and I am one of the national officer of Rasool Games and I'll be host for today's event. I just want to
Namaste,
welcome
Simran ji.
everyone. Namaste, namaste,
Namaste,
sir.
Simran ji.
Namaste, sir. So अभी सब join करेंगे and then I'll just introduction दूंगी and then you can start, sir. First speaker is you, Dr. Rakesh, sir.
The
And
first speaker will be Indu, madam.
first
Because
speaker. Okay.
so I'll
Go
just
ahead.
introduce. I'll introduce. You just hand over to us after introducing both of us. Just give
Okay.
first
Okay.
because our session is literature search and search string. So that comes first, and then we'll take my second session.
Okay,
Is
sir.
it okay, Indu?
यस
Yes,
सर,
yes, sir.
फाइन फाइन फाइन।
हमें भी सर्टिफिकेट मिलेगा सिमरन जी?
Yes, sir.
Yes, sir. Yes, sir.
Okay.
So युसरा मैम ये हमारी नेशनल डायरेक्टर हैं रसूख के।
Okay.
Yes, मेरे को just होस्ट करना है।
Sir, we are just waiting for Vivek to set up the YouTube live link.
Yeah, sure, please.
Good evening, sir. Good evening, ma'am. This is
Good
Vivek Sharma, IT Director of Games, actually. And currently now we are going live. So yeah, it's on live right now.
Yeah.
We'll start at 4:05. Just 5 minutes more.
Sure.
We are just waiting more people to join so that they can benefit from the session. Just for 4 minutes more. Okay, so it's 4:05. I should start. Okay, so good afternoon, everyone. Welcome to today's webinar.
Okay, so it's 4:05. I should
I'm
start.
sorry. I'm sorry.
Okay, so good afternoon, everyone.
Really sorry for technical issues. It was on my playing on my another device also, the YouTube Live. Okay, I'll start. Good afternoon, everyone. Welcome to today's webinar on basic research methodology organized by GAIMS, the Global Association of Indian Medical Students. My name is Simran Thakur, and I will be your host for today's event. We're delighted to have you all here and look forward to a productive and insightful session. First of all, I would like to tell you about GAIMS because a lot of you might not know about GAIMS. GAIMS is a think tank committed to advancing medical education in India. Our mission is to collaborate with government, private and autonomous medical institutions, as well as with academic leaders to provide world-class education to Indian medical students while ensuring compliance with government regulations. As a non-political organization, GAIMS offers expert recommendations to authorities to improve healthcare in India and beyond. We also support students through scholarships, travel grants, and organizing medical camps, creating opportunities for learning and professional growth. And also, I would like to highlight about the benefits of GAIMS Elite membership. For our GAIMS Elite members, you will have exclusive access to a series of upcoming workshops, both online as well as offline. This webinar is just the beginning. We have a comprehensive schedule of events planned to enhance your learning and professional development. Elite members can join these sessions and continue to grow with GAIMS. The link to join the Elite membership is available in the YouTube live chat also. You can see it later on. Okay, now about RASOG, because I am a part of it, and today's event is organized under RASOG. RASOG is a society under GAIMS. It's Research Administrative Society of GAIMS and is dedicated to fostering research and innovation in the medical field. RASOG provides administrative support, resources, and guidance to researchers, helping them navigate the complexities of medical research. Our goal is to create a vibrant research community that contributes to advancements in medical science and improve patient care. Today's event is organized by GAIMS RASOG under the leadership of Dr. Yusra Iftikhar. She's the National Director of RASOG. Now, speakers. I'm really honored to have two esteemed speakers with us today. Dr. Rakesh Garg. Some of you might be knowing him. He is a professor, Department of Onco Anesthesia, AIMS New Delhi. He's co-founder of and advisor of GAIMS as well. He's the editor-in-chief of the Indian Journal of Anesthesia. And now the second speaker, Dr. Indubala Maurya. She's associate professor, Department of Anesthesiology, Kalyan Singh Super Speciality Cancer Institute. Really honored to have you both here, sir and ma'am. And also now I would briefly outline the workshop. We have a comprehensive agenda lined up for you, including A, an overview of different types of research. B, how to conduct a literature search. C, how to develop a search string. D, writing a research question and PICO analysis. E, citations and referencing. And about the certificates of attendance will be provided to all the participants at the end of webinar. In the WhatsApp group, the link will be shared and you have to like 10 minutes open form link and feedback form. It will be associated with attendance. We hope you find this workshop informative and engaging. Without further ado, let's begin with our speakers. Dr. Rakesh Garg, sir, please.
Thank
It's
you,
over.
Simran, and thank you, Yusuf, for today's session. And thank you, GAIMS, for this initiative. I'm very sure that GAIMS is taking a lot of initiative with regards to the research and publications among various other activities being done by Global Association of Indian Medical Students. And the whole team, I must congratulate the whole team of GAIMS for doing wonderful work from not only academic point of view, but also the social support. So thank you for giving us this opportunity today, and we'll try to do justice in next maybe around 90 minutes or so, talking about the key aspect of research and publication. Now, when we talk about the research and publication, there are certain steps of doing them. And we think of some research ideas, we think of some research question. The first thing that comes to our mind is that the research question or the problem that we are thinking of, is it really for us or somebody else has done it already and maybe we are not aware of it? And in case if you think it's a new one, we still have to look for the literature, because when we plan a study, we need to know various aspects, various components of the research protocols, the method, and its execution. And hence again, we need to go back to the literature, to the review, so that we can identify those aspects which will make this research more robust. So overall, I can say that a good research requires a good researcher, but he needs understanding the existing literature. And this existing literature is sometimes we think that we put some keywords into the Google and it will give you a lot of information. So it is something like garbage in and garbage out. We cannot turn anything. And same is with Google, because there will be so many unpeer-reviewed contents into the Google, which will not be good for planning a research or doing a research. And hence, we need to have some systematic way identifying the pertinent literature, and it is a process. And what this process is, we have Dr. Indubala More with us. She will take us through what to do, how to do, what to have inputs, and where to search for. So over to Dr. Indubala More. She will take us for the literature search and various components. It's a very broad term, but you will realize that it has many other components which need to be fitted in so that we can have some good output. Welcome, Dr. Indu, and over to you.
Thank you, sir. I'll start sharing my screen. Hope it is visible.
Yeah, visible. Audio,
Yes.
video, all clear. Yeah.
Okay, thank you. Good evening, everyone. The present topic for my presentation is literature search and search string. It may not be possible to cover all the aspects, but I have tried to cover it so that in initial stage you can do it easily. I'll briefly cover what is the literature search and important feature of PubMed, how to search on PubMed using keyword, mesh term, and Boolean operator. And I'll show you how to do it basic search and advanced search. First of all, what is literature search? Why we are talking about literature search? It is systematic way to search for literature for a given research question. Before starting literature search on PubMed or any other platform, you should know what do you want, what is your research question, and that literature search should be reproducible and documented. Means on the same question, research question is same. If somebody is doing that using that search string, we should able to get the same result. The common literature databases are PubMed, Embase, Cochrane, Web of Science, even Google Scholar Scopus is there. But I am covering only PubMed. And this is the actually basis. If you understand the basis of PubMed, almost similar technique can be utilized on Embase and Cochrane also. And only the interface will differ and some nomenclature will differ. What is the gray literature? Sometimes if you read all the published articles, especially systematic review or meta-analysis, if they have gone beside these databases and they have searched few literature. Sometimes any new contents come, but literature is not there. Peer-reviewed content is not there, but that is very important. Like during COVID time, many new literature were coming. We were not sure that literature you can use for your search, and sometimes you can use your any country or state registry or in trial registry, and even you can go to your library if any thesis dissertation is there, if it is not means like published, but if it has good content, good methodology, that you can also take it as advantage. That is all these considered as a gray literature. Why are you talking about search strategy? Why I was thinking about we can type on Google or PubMed, but we are thinking about it should be proper way. Why designing is important? Because we have vast literature and their quality will vary. Not all will follow any robust methodology. And sometimes what happens, one article says in different word, another article says different word. Means they use some kind of generic word. So thus to make uniform, the search strategy is important. And if any of you know that what is systematic review meta-analysis, why it is done, if you go through that, there is prisma diagram like this. In this prisma diagram, first step is how many records you got from each database and registry. This is very important step for research systematic review. So that for that also it is very important we should have exact and proper search string. Just to summarize, you should have clear research question. You should have well-defined inclusion exclusion criteria. You should use more than one databases, more than one reviewer, and you have series of discussion and some do pilot research. Because what I have told here, it is primarily very important for systematic review and meta-analysis. If you are going for clinical trial, even then also you can use same similar concept in the clinical trial, for clinical trial also. There is one checklist, press checklist, peer review of electronic search strategy. It has, this checklist has just summarized, you should use natural language, search as keyword, use appropriate word truncation and spelling variation. What is word truncation? Truncation means like one word start, you can have multiple variation like depress. It can be depressed, depression, or depressive. So that is word truncation. It is written as a depress asterisk. What is spelling variation? Like UK, US spelling variation will be there, like esophagus. Some start with E, some start with O. That also we have to take it care of when you're putting search on the PubMed or any other databases. Use appropriate language limit. You don't want, if we don't know French or German, we don't want that. So we have to put filter for English language. Suppose you want last 10 years, so then you have to put the filter for 10 years. And appropriate publication types and author, that also you can use for the search strategy. Now coming to PubMed, I'll be covering only PubMed because this is most common database we are using. This is free bibliographic database which is managed by National Library of Medicine and NCBI. It does not actually include full text. It provides link to the full text either through the publisher website or PubMed Central. It contains millions of biomedical literature from Medline. Primarily, it has three components: Medline, biomedical, PubMed Medical Central, PubMed Central, and Bookshelf. With Medline, this is a major component of PubMed, which has mesh terminology. It is all the article associated with mesh term. I'll discuss later. While PubMed Central and Bookshelf, both are full text archive. What PubMed Central? PubMed Central is like means funded projects which are freely available to all the author. That will be fully available through the PubMed. And Bookshelf are books and chapters, some reports. It will not only abstract, it will be full. Both will be full, but Medline, it is primarily abstract, may be available through your institutional login ID, you can get it. Before searching, I'll suggest you should have your NCBI account. Or you can say PubMed account. Even without account, you can search it. But it is easy if you have account. It is easy to keep your history, browser history, and you can save your searches. You can check for check later, and you can create alert. Like you have searched from some topic, and you want any new literature is coming. You want a monthly update or weekly update that you also do with your account. And there are number of options through which you can log in PubMed account. I have logged in with a Google account. Next screen side, like here. This screenshot, like I have logged in with my Gmail account. It is having dashboard, my publication, and different settings are there. This is my dashboard. You can see here. It shows my recent activity. Here is my collection. Like here, I have kept one search for my systematic review. What to be entered? Now you have PubMed account, you know the PubMed interface, what to be put on search bar. Either you put keyword of your research question, medical or mesh term, or you connect with Boolean operator. I'll discuss one by one. Coming to keyword, what is keyword? Before understanding keyword, you should have one valid good research question. And that research question has to be broken into the concepts. And for each concept, you have to think about the keyword. Suppose there's one research question. It is simple only, hope you should be able to understand. Is ultrasound guided central venous catheterization in adult safer than the landmark technique? This research question, this is the research question. This is in PICO format. There are different formats are there, but this is most commonly we are using. But basic is same. P stand for patient, population, or problem. So what is the patient here? Adults are patients. What is I intervention? That is ultrasound guided central venous catheterization. This is my intervention. This is comparison, landmark guided. This is landmark guided. We are comparing landmark with with ultrasound guided central venous catheterization. And outcome. Because we are talking about safety, which is safer, means outcome will be complications. Now, research question was broken into different concepts, like you have to break it. Now we have to think about what are the different synonyms for my keywords. Like adults can be written as adult, simple adult. For keyword give flexibility. You can think about all the words that can be almost similar, almost synonyms. Or ultrasound can be written as USG, ultrasonography. Or central venous catheterization can be written as central venous catheterization with Z or S. This is UK or US variation. CVC, central venous insertion, central line insertion, central venous access. So these are the synonyms. It's so same. This is word for same concept. Landmarks can be written as landmark, landmarks, anatomical landmarks, anatomic landmarks, and many more. What you can think of. And complication. Usually we take problem, intervention, or comparison and comparator or comparator group, comparison group for search, unless complication is very specific, unless like mortality or pneumothorax, like very specific. We'll usually don't take complication for search. These were the keyword. Like you have research question, you broken into concept, you got the different keyword for the concept. Now, because keyword we are generating, we are thinking about these could be the keyword. But what could be the standard word? What Medline has tagged to the particular article? That is medical subject heading, mesh term. This is control vocabulary. It is feature of Medline. Means all the literature which is coming through the Medline will have mesh term. It gives uniformity to the indexing to the biomedical literature. It is just like a hashtag. Like we are using on Twitter or Instagram, like this particular article will have these number of mesh term. It connects all the different ways to express the concept. Like we central venous catheterization has different ways, but mesh term will be one. Okay, so this is way of expressing one concept, and it will give single word. And these mesh term is revised annually. It is not updated daily or weekly. It takes time. It takes a year, and it is done by humans. Like it's manual. It is not automated. Just take example. Like this is the one article which I have searched on the PubMed. If you scroll down, you'll get the one title. There will be abstract. If you scroll down more, down all the mesh term associated with this particular article will be shown here. If it is coming from the Medline, that you have to think about. If mesh term is there, means this is coming from the Medline. If it is not there, means coming from other sources, either PubMed Central or Bookshelf. But how will get mesh term? We don't know what is the mesh term for central venous catheterization or ultrasound. For that, on the home page, you go to mesh database. You click on mesh database. This page will open, and you write your query, your keyword. Actually, you write it and put search. If you put search, like I tried to write central venous, it auto populate number of. It gave option actually. So I thought first one is okay. I'll put search. Then I'll get this central catheterization, central venous. This is the mesh term for central venous catheterization. When you are actually searching mesh term, either you can put in the search builder, you can search it, or you can just note it down some Word document or your diary. If you scroll down more, it is another, it is next, means like it was upper portion. If you scroll down, you will get these subheadings. This is subheadings. After that, there is the entry term. If you put any of these, you'll get same mesh term. These are mesh tree. This one, mesh tree. I'll demonstrate actually. It is not easy to understand here. Again, just to revise it, mesh term will have main heading, subheading, supplementary concept record, and publication characteristic. Again, here, if I'll go in same article, same page. If you see in mesh term, there is one mesh term is there, intubation endotracheal and slash, then adverse effect. So this is the actually main heading. Adverse effect is the subheading. Means it is talking about the adverse effect of intubation and intratracheal intubation. Same with laryngoscopy. Here, adverse effect of, they are talking about adverse effect of laryngoscopy. There are few mesh terms which is actually not in this hierarchy tree, like new protein or molecule or any new concept. That is actually supplementary concept record that comes under substances like pro-BNP. Like in this article, these are the mesh term, but all the markers are under the substances. These are supplementary concept record. Actually, these are the different categories like semester. If it is in hierarchy tree, it will be there. But if it is not there, they have put under the substances. This is just to complete the list. There are 16 main branches. Means your mesh term will be one of these main branches under the subheadings. What is explosion? I'll just show you. Actually, otherwise it's not easy to understand with these static images. My PubMed page is visible. Hello?
Yes, ma'am, it
Yes,
is.
ma'am, it's
Okay.
visible.
Okay. What I am going to do, I am going to search for mesh term for breast cancer. Why? Because breast cancer can be written as a breast malignancy or breast neoplasm, but I don't know what is the mesh term. Then I'll go to mesh database. I'll click, I'll write here breast cancer search. You can see my search results showing almost 62 results. But which definition I have to choose, which one I have to choose, that depends on your research question. Suppose I was searching for breast cancer, that's common, simple, breast cancer only. So the first one, which is breast neoplasm. I'll read what is the definition, tumor or cancer of human breast. I think this is okay for my research question. If I'll click on this, you'll see these pages, what I have shown in that screenshot. So in starting, there will be, this is mesh term for breast cancer. This is known as a scope note or a definition for the mesh term. If you don't know that, you can read it, at least it is fitting to your research question or not. These are the subheading. Means like if you want to read about only pathology of or physiopathology of neoplasm, you can click it. These are the entry term here. If you put any of these, mesh term will be the same, breast neoplasm. If I'll go down here, this is the mesh tree. It's like a dictionary, like indexing, like how my word has been put in the mixed dictionary or directory, sorry, not dictionary, directory. So this is in this category, neoplasm is coming under neoplasm by side. This if I'll go above it, it will broaden my search. If I'll go down, it will narrow down my search. So if I'm taking breast neoplasm as a mesh term for my research question, it will include all the narrower term in search strategy. This is known as explosion. Suppose my research question says I want only neoplasm in male. Then I have to go and narrow down my search. I have to click on breast neoplasm for male. And there is no narrow word below this. Okay. Now coming to, this was an explosion. Suppose I only with single mesh term, just to emphasize, you should not use single mesh term for literature search. Always club with keyword with Boolean operator. But just to show you how you can use with, because this is the first step to learn how to use mesh term for PubMed search. Suppose central venous catheterization was there. What I'll do, I'll click add to search builder. It will add this mesh term to this box. I'll click search builder. Now it is showing catheterization central venous as mesh term in search builder. If now I'll click search in PubMed, it will show my result. I got 17,431 result from central venous catheterization if I'm using as a mesh term. Means all the literature what I am seeing, it is coming from Medline. But again, I have told there are many literature which is outside the Medline. For that, you have to use all the keywords. So just to summarize, what is the mesh term? This is for uniform indexing, is only for the Medline, and it checks all the variation in spelling and in spelling or synonyms. And what is the drawback? Because we don't have mesh term for every topics, and it takes time to allot mesh term to any published article. That's why we should use both mesh term keyword together for literature search. Okay, and before that, again, just to revise, you have research question broke into different concept, then think about all the possible keywords yourself. Then for each concept, look for mesh term from the mesh database. That also you have to note it down. Now you have to club together for the literature search. How you will club together all the keywords and mesh term? By using Boolean operator. Boolean operator are 3 Boolean operator: and, or, and not. All are written in capital letter. These are used for broaden or narrowing your result. Just try to understand. Suppose we have one result with keyword, or two keywords are there: central venous insertion and ultrasound. Suppose A is central venous and B is ultrasound. If I'll put and between those two, means it will include only literature which has both as a keyword. So it will narrow down my result. If I'll use or, means A is central venous, B is ultrasound. If I'll use or, means either of it, so it will broaden my search result. Means it will include both A and B. If I'll put not, it is least commonly used. Central venous insertion, not ultrasound. With anything which is after not will be excluded. Means in A, any central venous catheterization which has used ultrasound will be excluded. All the non-ultrasound, all the central venous insertion without ultrasound will be there in your search result. This is the Boolean operator. And or is most commonly used, not occasionally is used. This is the final step for literature search. You got your research question. You have broken into different concepts based on PICO, patient intervention, comparator, and outcome. You got your concept and keyword. For each keyword, you got mesh term. So what will happen? You'll have different blocks actually. Like this block is for ultrasound, means it will get all the keyword mesh term for ultrasound. Because these are synonyms, you have to use or. Another block is for catheterization. Keyword and mesh term for central venous catheterization, use or in this block. Then keyword and mesh term for landmark, use or. And you have to club all three by the and. Then you will get actual result. It looks tedious, actually. It is tedious because it's not single step process. It takes time. So, and you have to give trial, means like whether I am able to get actual result or not. Just this is example. This is one of my systematic review, this was the actual result. Suppose whatever research question was, but it has 3 blocks here. One was diagnostic imaging, another was central venous catheterization, another was subclavian vein catheterization. So what they have in each block, they have connected all the words, keyword or mesh term using or. Same with here in second also we have used or. If I'll get then there, if in first block I got more than 12 million results. With second block, I got 68,000 results. In this, I got 8,000. If I'll connect all 3 using and, it will narrow down my result. The final result was 1,720 article. This was for systematic review. This search string, this is actual search string, complete search string for a research question from PubMed, which is very important for systematic review and meta-analysis. Now coming to PubMed search, basic search, like most of the time we do, like we have just one topic or one word we want to search it. What we can do, we can just write in search bar. What is there in all home pages? You will get search bar. You'll just try to just write. While typing itself, it will show the different options. Like it will auto populate. Like if I'll write intubation, it showed endotracheal also, rapid sequence or tracheal intubation. Suppose I click on tracheal intubation. I got more than 51,000 results because it is very broad. I don't know what exactly I want in tracheal intubation. I can't read here from 50,000 this many results. There are many filters on the left side. If on check on the left side, my search almost started from 1916 and till today. So if I want only clinical trial or meta-analysis or some just review, I can click and I can filter from these articles. Or if I want only last 1 year, what is the latest, that I can also put the filter here. There are some additional filters. If I'll put on this additional filter, there are many filters are there, like article type, species, even article language, you can filter it, gender, age, and many more are there. But I want full text of an article. Again, just to emphasize, PubMed doesn't give full text. It gives abstract only. It gives link to the full text. If it is available through the PubMed Central, if it is written like this, free full text PubMed Central, means either it is made freely available from the publisher or it is funded project. That's why it is available. Or it will give link to the original publisher, where if it is freely available, you can see it. Otherwise, it will be paid. In basic search, 2 important things you should know: what is automatic term mapping, what is phrase searching. That also I'll show with her demo. I'm showing you how to do basic search. This is search bar. Just you type anything here. That is basic search. I have to show automatic term mapping and phrase searching. The pulmonary hypertension. It's already showing pulmonary hypertension. I'll click search. So it is showing 85,000 some results. So automatic term mapping, what is that? If I'll go to advanced, in advanced, there will be results. If I'll click on result, what is it is doing? Actually, automatic term mapping means it is by default setting in PubMed. It is taking your words, keywords. It's trying to search in mesh term or all the field. Like it is pulmonary hypertension. It tried to search as a mesh term also, or in all the field, or hypertension and pulmonary along with and, means he's trying to make some search string. He has prepared search string itself. This is automated term mapping. Again, if I'll go to home page, if I want as a phrase, like I'll put in inverted comma, I'll write pulmonary hypertension, but in inverted comma. Means it will not break it in two. It will not read pulmonary and hypertension separate. In automated term mapping, it was reading together also, it was reading separate also. But if I'll put inverted comma, it will read as a phrase, pulmonary hypertension. If I'll put search, it has reduced my number of results because it is seeing all the article which is showing pulmonary hypertension as a single word, like like ARDS, acute respiratory distress syndrome. If you write acute respiratory distress syndrome, even though it will show all the article with ARDS, but many article will be there where it will break it in different words like respiratory separate and syndrome separate. Respiratory and distress separate. It will separate it in different words. That's why you have to put in inverted comma if you want to search for particular phrase. This is basic search. I'm not, if for advanced search, why we're talking about advanced search? Whatever we saw on how to make search string, that is like result of advanced search. It will search your term in different field, like in mesh term field or all field. It will help in making large and complex search string. And you can see how search was translated by the PubMed, like how it did it actually. Like I have shown for pulmonary hypertension, you put pulmonary hypertension, but you go and see in history how PubMed read your entry word. And you can compare with different queries actually. This is for advances. Again, go to home page. If you click on this advance here, you will get this page. Here you have to put your search term, put and. Suppose I want with mesh term. From all field, I'll go to mesh term. I'll put mesh term. Because I have checked already for ultrasound, there is a mesh term ultrasonography. I'll put in this term and add with and, because these two are different from different concept. Ultrasound is different and central venous catheterization is different. So I will use word and. If I'll put and I'll click on search, I'll get this many results. So this was the actually a simple string. This is not complex one. This is simple string using mesh term. This is the advanced search. If you learn how to do basic search, first learn for simple string, then you can learn next step advanced strings, advanced and complex strings. Just for practice, because it's online, it's not very easy to interact, but anyhow, just understand this is the research question. Is cigarette smoking associated with female breast cancer? What is the keyword here? Keyword means first you have to break it in PICO format. What is P here? Or patient or population? Women, female actually, female. Then I'll think about what I can write for female. I can write women. Now this is keyword actually. Both are keyword. Now in intervention or exposure, what is intervention here? This is cigarette smoking, means this is exposure which is causing breast cancer. So intervention will be smoking, or you can think of other keyword. It could be smoker, cigarette smoking. It can be BD smoking also, or hookah smoking also. That you have to think about research question. Do you want especially cigarette smoking, or I think smoking will be both cigarette and BD or hookah or cigar, both will be included as a keyword. What is comparator? Because smoking is the intervention, comparator will be non-smoker. Then keyword will be, one keyword can be non-smoker or no smoking. Or here outcome is breast cancer, already written here, breast cancer. How it can be written another way? It can be breast malignancy, even breast neoplasm. Now we have all the keywords. For each keyword, you have to go to mesh database and look for mesh term for each segment. Then you club together with Boolean operator. That will be your actual string for search strategy. Next, just for practice, find out the mesh term for COVID-19 infection. We'll check what is the narrower term in the mesh tree, and we'll put in search builder and see what is the result. Okay. What was the question? Was the mesh term for COVID-19 infection. Okay. Then I'll go to mesh database. I'll write COVID. And one thing to note, PubMed doesn't read hyphen. Whether you put hyphen or not, it's same only. COVID-19 infection. Search. There are two results are there. Which one you want? I want, because it is just, I wrote simple, because that should be, that concept should be clear in your mind. Which definition do you want? Like this is, first is COVID-19. This definition is given. Another definition is breakthrough infection. But I think I want this one, first one. If I'll click here, what was the second query? Second query was, what is the narrower term in the mesh tree? I'll check, this is definition or scope note. And you can see here, year introduced. It was introduced in 2020 or 2020, revised in 21. Here, in most of the term, there it will be shown here. These are the subheadings. These are the entry term. Whichever you put in search bar, you will get the same result. This is mesh tree. Like COVID-19, narrower term is post-COVID-19, post-acute COVID-19 syndrome. Means if you take this for definition for your search, all the article in, having post-acute COVID-19 syndrome will be included. Understand that this mystery. If I'll broaden, means I'll see COVID-19 is under pneumonia, viral pneumonia. It is under pneumonia. It is under respiratory tract infection. It is under infection. It is under disease category. Actually, this is the mystery. Just to understand, means how my this term COVID-19 is there in this directory, mesh directory. It is within the pneumonia, then pneumonia. It is actually, if I'll go above, it will broaden my result. If I'll go down, it will narrow down my results. What was the next query? Next query was add in search builder and put PubMed search. Because my definition is correct, I want to put in PubMed search builder. I'll click add to search builder. Because this is mesh term, it is showing mesh term, and I'll put search, PubMed search. It is showing almost more than 2 lakhs results. Here you can see all the years, year of publication date, text availability. Suppose you want only full text or free full text, you can click, you can get it. And it is all the article type, and this is additional filter. Suppose I put only English, it will reduce the number. Because so many, it was more than 2 lakh, now it is coming to 35,000 only. Because many articles are in non-English language. This is so important for us. Suppose I want only, this was, no, that was, sorry, that was, it took by default because of setting of my, this PubMed page. I'll just remove. It's not, I'll clear applied filter, then again I'll show you. This is more than 2 lakh results. If I'll put, what it is. Okay, now all filters are gone actually. So if I'll put English one, I'll see how much it was coming. Before that, it was wrong actually. It is there, but it has number has reduced, but definitely it is more. if I'll put all the patient who are aged more than 65, all the article which is related to aged person, geriatric age group, if I'll click, it will narrow down my results. Okay, like this, you can put all the filters. If I want only clinical trials, this many results in English in aged patient. Okay, like that, you can put filter. You can search for your mesh term. Just to summarize, know your PubMed platform. Actually, you should have your account. Try to think try to search what are different interfaces in PubMed, and know your research question. What exactly do you want to search? If there is research question, proper research question, then there will be proper search string. If it is just one few words as there, like you just want to know about anemia, this is very broad. Like if you put on anemia, it will show all type of everything. Means like, that's why you should be clear, anemia in children or anemia in particular patient like pregnancy. That's why you should have research question. Break research question in concepts, and each concept think about keywords. That is your freedom. You can think about all the freedom, with freedom like different spelling variation, different nomenclatures. And then for each concept, look for mesh term and combine all the keyword mesh term using Boolean operator and put in search PubMed search and apply appropriate filter. Then you'll get appropriate result for your research questions. If in case of any doubt, on PubMed itself, there is user guide. Actually, you can refer it. I actually read from there only. There are small videos are there, but it is in. They have written actually how to go for advanced search, how to look for the mesh term. Thank you for your attention. Any question?
Thank you so much, ma'am. If anyone has any question, you can type that in the chat box. And ma'am, do you want to take questions right now or at the end of session?
By the end of session, we can take, as sir says.
Okay, we'll take at the end. In case if right now there is nothing in the chat, so we'll take
Okay.
at the end.
I hope it is not too much for them.
No, I think you have told very clearly, and you have explained them online also. I think they will just now have fun on the PubMed, and
Actually, they can try. It had been hands-on then, but anyways, they can try.
Next time we'll do in the GAIMS annual conference.
Yes, sure.
Yeah, sure.
Thank you so much, ma'am. Now
Thank
I think sir will take over. Thank you, ma'am.
Okay.
So now, once we have learned the basic concepts of looking for the search of whatever topic that we want to choose for the research, we also need to put it and understand various other aspects at what study design would be good. We just mentioned about the research question. So what research question should be good? What should be the hypothesis? And a little bit of selecting the right study design and how to proceed further. So maybe in the next half an hour, we will go ahead and discuss those aspects also. Now, when we talk of research, the basic purpose is that we want to follow the evidence-based medicine. And when we say evidence-based medicine, it requires all the aspect, which is we talk about the clinical expertise, and we also talk about certain decision-making, which is based on the patient preferences and values. So this means when we do a research, it is not merely the existing research, but we also need to incorporate the patient's requirement, the clinician expertise, and the need for that particular reason, geographical reason, to integrate into certain evidence which is most suitable for that population. And that's why if you think of the hierarchy goes something like this in the research, and somewhere the meta-analysis remains on the top because it incorporates certain methods, certain statistical tool to give something conclusive outcome from multiple studies. And that's why it remains on the top of hierarchy for the evidence. Now, when we talk about the research, primarily or very broadly, it can be divided into primary and the secondary research. Primary means we conduct the studies, we have some research question, we conduct them. Secondary research means the research which has already been published, we try to do a reanalysis, we want to a pooled analysis, a systematic review, meta-analysis, and so on and so forth. Those becomes the secondary research. Now, among the primary research, we have basically broadly three components: the basic research, the clinical research, and the epidemiological research. Now, basic research is basically theoretical or applied. Theoretical is more of an where we talk about certain physics aspect of certain things, or biological aspect, or major aspect, or imaging procedure in medical sciences. This becomes very basic research. We talk of anatomy, physiology, molecular aspects. And in the applied, when we try to do them on animal studies, maybe the cell culture, the cell growth, the cultures and all those things, the genetic analysis, the biochemical analysis, and then develop certain reagents, certain drugs, they all becomes the basic research. The clinical research is primarily of two types: experimental or interventional, and the observational. In interventional, you do something, you intervene with a technique, with a drug, with a method. In observational, you continue studying the patients as per the standard of care or the gold standard, and you observe certain parameters and try to look for what these have impact on certain parameters. But you do not do specifically some intervention which is different among the various groups. Epidemiological research, again, it will be experimental and observational. Basically, it is more of a field approach where you try to collect some parameters. Maybe sometimes you try to compare with certain other groups which has been completed in the past. They becomes case control study. But sometimes you just do a cross-sectional view across the a particular area, or a particular selected catchment area, population coming to the hospital or the OPD. You look for certain parameters and try to analyze them. So this becomes the epidemiological research. And secondary research is systematic reviews primarily, and it could be the meta-analysis. Meta-analysis is basically when we pick the individual data from an individual study and try to do some using some statistical tool, try to make some meaningful inference from them. That becomes a meta-analysis. And these are the secondary research. And probably this has more values because the studies individually may have some different outcome, but if they have been done similarly with similar method, probably if we pool them, we'll get more robust outcome, and that becomes the meta-analysis. So these are the different types of researches that we talk about. And when we talk about these researches, we also need to pick up a plan or a protocol so that we can translate the research question or the conceptual hypothesis into an operational one. And for this, we need to pick up that how are we going to proceed for stepwise approach for taking the research question to a meaningful conclusion. So this is very important that we need to choose the study design appropriately because it is based on ethics, logistics, economics, scientific thoroughness. And probably when you have a research question and you have done some research, some review of literature, this will also guide that which design would be appropriate for that particular study. Some studies would require a randomized control trial. Some studies will require a cross-sectional study. Some study will require a case control study. So this means depending upon the research question, there is nothing called if you can categorize them into particular groups, but this will all depend upon what topic that you are thinking of, what research question and outcome are you thinking of, and what does the review of literature says. Based on this, you can think of what would be the most appropriate study design. Let's see some of them now. Now, when we talk about the study design, one of the important aspects is that you're collecting the data in which direction. Means you are going in the past, you are in the present, or you are in the future. Now, in that situation, if you are talking about in the present, whatever the existing population is, you want to look for certain parameters at a point of time, it becomes a cross-sectional study. On the other hand, to go in the past backwards, look for certain parameters, it becomes a retrospective study. And in case if you want to follow them in future by some interventions and follow them up, this becomes a prospective study. So basically we divide them retrospective, cross-sectional, prospective based on the direction of study. So this should be clear. Sometimes we use combination of them. We analyze certain data from the older records or identify certain parameters by interviewing the patient or looking for their previous records and data. And for some patients, we follow them up in future, or they can be followed them in future. This type of studies become ambidirectional study. So based on the direction of study, we have 4 types: retrospective, cross-sectional, prospective, and ambidirectional. Now, if you look this study, examination of factors affecting the length of stay in a palliative care center. Now, in this, they have just collected the data from the records of the patient. So this would be a retrospective study. So they were just looking for factors affecting the length of stay and discharge of patients from a palliative care center. So they have the data, they have the patient profile, they have the patient's duration of length of hospital stay. So they just examined those, and it is an retrospective study. Now in this, they want to evaluate the net effect of RBC transfusions in routine provision of palliative care. They want to give RBCs, red blood cells transfusion, that is blood transfusion, and they want to see how does it affect patients who are receiving RBC transfusion in patients who are receiving palliative care. Now, they want to see the prospective aspects. And so any patient who would require RBCs will be admitted, will be recruited in the study, and they will see the effect. So this means they are collecting the data, they're doing some intervention, and they are collecting the data in future, in follow-up, to look for their effect. And hence it becomes a prospective study. In cross-sectional study, you select a population, maybe a medical college or maybe a rural area or an urban area, you select it, and you just try to analyze that what is happening at that point of time. You study the subjects and look for that with certain parameters, if somebody has an outcome and somebody does not have outcome at one point of time, and there is no direction. So you say, if somebody is a smoker, does it have respiratory disease? Somebody is a drinker, does it have a pancreatic cancer? They're not doing follow-up. They're just looking for those parameters and with outcome and without outcomes. That what is happening at a point of time in a particular selected area. For example, you want to see a preferred place of care and that in terminally ill patients with lung and heart disease compared to cancer patients. Now they just followed up all the patients who are eligible, recruited, and they just asked this question, that which is the preferred place of care and death in these patients who are terminally advanced, the cancer patients versus non-cancer patients. So they know that a particular patient is a cancer patient, particular patient, non-cancer patient. They will ask that during the end of life, which is the best place or preferred place that you want to stay at home or into the hospital or in the ICU. So this is called a cross-sectional study. Ambidirectional, sometimes we follow them up, like in this patients manage for pain without counseling. And now you introduce that all patients will receive counseling and you want to see its effect. Now you counsel all patients and you follow them up. So you have a retrospective cohort where you have looked for patients who are being managed for pain and they have not received counseling. Now you have introduced counseling into your OPD. You are managing pain. So this will become ambidirectional study. Now, sometimes we also use case control study. This is another study design. Case control study, by word, it looks that a study has a case group or a control group. So this is not as simple as that. It is something different. It requires more understanding, and it is more, when you do this type of studies, you want to answer a question, what happened? Now, here you usually go backwards, retrospective. You have the cases, you have the controls. You have a patient with lung cancer, you have a patient with no lung cancer. And you follow them up back. You ask certain questions, that whether they were exposed to smoking, whether they were exposed to occupational hazard like silicosis, and follow them up. And in this, you look for exposed versus unexposed in both cases and controls. And cases as controls also needs to be matched. They should be similar, because here you are not doing randomization. So here what do you do? Matching. And you match that case and control should match in certain parameters, which is important for the outcome that we are looking for. And this becomes a case control study, which is a retrospective study. For example, here the methadone and corrected QT prolongation in pain and palliative care patients. Here they have looked for the QT prolongations. They have looked for patients receiving methadone and non-methadone, and they are followed back for looking for those features, and it is a case versus control study. Now, coming to the cohort study. Cohort is when you try to follow them up and look for certain outcome. And this is where in cohort study, you want to answer a question, what will happen? You select a cohort. They are exposed naturally to something, maybe like smoking or rural versus urban area or any other parameter. And then you follow them up and look for whether they have certain outcomes or not. And this becomes a cohort study. So it's follow-up for looking for certain parameters. Like say, for example, somebody joined an IT industry. He has a more sedentary lifestyle now. Now you follow them up and see whether they develop obesity, they develop hypertension, they develop diabetes or not. And you look for those outcomes. And for this, you can have controls where those people who does not have sedentary lifestyle, like a laborer, like a worker, physical worker, and you compare them for the outcome versus without outcome, and you follow them up. And this becomes a cohort study. For example, in this prospective cohort, association between complications, comorbidity, and utilization. So they have given certain medical care to these patients, and they have follow-up in future for certain complications. Certain will develop complications, some will not develop complications, and they will follow them up, that what factors were responsible for the same. So this is what the principal study designs are. Now looking for some interventions. Now, if you do an intervention, it's an experimental study. If you don't do it, it's an observational study. In observational study, you can always compare, and that becomes an analytical study. If you don't compare, it's basically a descriptive study. In the observational study, if you do analysis, if the direction of study is from exposure to outcome, it is cross-sectional study. And if it is from outcome to exposure, it becomes a case control study, and I've explained it just now for you. And in case the direction of study is from exposure to outcome, in that situation, it becomes a cohort study. So this means whether you're going back, front, or at one point of time, in cross-sectional exposure outcome, everything is looked at one point of time. You're not finding case control, you go back, you have an outcome and look for the exposure. In cohort, you have the exposure and then you look for the outcome, it becomes cohort. In experimental study, you do some intervention, usually There could be sometimes a non-randomized study also, but now we do randomization for these patients, which is very, very important to take care of various biases. And that is why the randomized controlled trial are good, because it eliminates many biases and confounders that can happen. Let's see some example. Now, this study off-label medication use in inpatient palliative care patient unit. Herein, they have just looked for that what are the medications a patient is taking and which are them off-label. So it's an observational study. Now, in this study, the physiotherapy has been introduced. Outcome is the reduction of fatigue in advanced cancer patients. So one group receives physiotherapy, the other groups does not receive physiotherapy, and outcome is fatigue here. Patient population is cancer receiving palliative care, and they have used randomization and allocation concealment. So this type of experimental study is an interventional study, and it is labeled as randomized controlled trial. Usually, randomized controlled trial are considered to be the gold standards because they answer the question very concretely, and they have minimal level of bias into the studies because you are following certain principles which are part of RCTs. Now, clinical trials, the studies are prospective one, and usually you try to compare them with certain existing standards of care, or you are comparing them with gold standards. Now, when we do these studies, you have to follow certain steps. Yes, I agree that each step probably review of literature would be required to answer and make a good protocol. And once you have a protocol, you need to define your reference population, sample population, which patients will be included and excluded from your study. You randomize them, you provide them interventions, a control group, which is usually a standard of care or usually a gold standard, an experimental group, which will be something new intervention, new drug, new route, which will be compared with the control group. You do the interventions, you record the outcome of these interventions depending upon at what time period you want them. Some may be immediate, some may be little delayed, some may be long term, and then follow up and analyze your result and put your outcome. We have already discussed that all those points were required. For example, when you talk about exclusion criteria, you should know which are the confounders that can affect your outcome. For this, again, you need a review of literature to understand which are biased for the particular study. You also need to identify a research problem, and we need to understand that process. So once we have a review of literature available for us based on our clinical problem, with clinical deficit, we try to formulate a research question. We select a research design that we just discussed. We do the study, collect the data, interpret findings, publish it, which becomes review of literature for future research. Review of literature, what, why, where, how, we just have discussed. Very important session it was. I'm sure you'll be able to get help out of it. Once you have all those things, try preparing a research question with clear aims and objectives and hypothesis. Now, research question is important because we have discussed in the review of literature also. Until this research question is clear that what actually are we going to do is what is required for all purpose. So when you have a clinical problem, you have done a basic review of literature, you think something needs to be done, try formulating a research question. And this is mandatory that our clinical problem, based on discussion and initial review, we are aware of certain lacunae in the existing literature and will translate into a research question. And research question, again, new ideas, new equipment, new drug, your clinical observation, your variability in clinical practice. These are the cues for giving you a research question. And this is important for variable reasons: protocol writing, selecting a study design, making a method section, sample size calculation, and so on and so forth. So this is important that you choose a right question so that you can guide a right problem. But remember, when you plan your study, preferably try to have single research question, because it is required to have sample size and many other factors. Picking up multiple research questions will be difficult to answer because they will have some different requirements in the study process, and hence it becomes difficult to answer multiple research questions. So it will be good if you can pick up a primary single research question. And when you pick up those research questions, there are certain requirement of criteria that can help. The first mnemonic is FINER criteria. When you choose a research question, that is a clinical problem translated into a research question, think whether it is feasible, interesting, novel, ethical, and relevance. Feasible means you are doing a research, you should have the infrastructure, the patient profile. If you're doing some investigation, they should be available to you. So this means to do that study, everything is available at your source so that you can do those research. It should be novel, something new, and that's why it should be interesting to you also, that you are with interest doing it. And it should be ethical. I mean, it should follow, there are certain ethical guidelines. For example, if you are comparing a new drug for analgesia, you should not say that the other drug will not receive analgesia. It should have a standard of care and should be compared with a new drug. Relevant. It should add something new to your knowledge, something new benefit to the patient, maybe with regards to that it improves analgesia, it decreases the length of hospital stay, it enhances the recovery of the patient, it improves the quality of life. This means something relevancy to the financial aspect, to the recovery aspect, to the disease aspect, whatever it is, it should have some relevancy when you do those research for you. And once you understand that FINER criteria is put up, you put into words. And for those, a complete research question should have PICOT component, though there are certain variation, PICOS or PICOS, but PICOT is a mnemonic that should be included when you frame a research question. So a research question should have all these components. It should mention the study population, that is P. I, that is intervention or the experimental new things that you are doing. Control against which you are comparing the intervention. And as I mentioned earlier, I'm repeating it again, this is important. It should be a gold standard or a standard of care or a institutional protocol. It should also mention what outcome are you looking for at what point of time. So this is what must be the component of a complete research question. It should not be missing any aspect, then it will not be a complete research question. And when you're submitting for maybe protocol submission from approvals or for publication, it will be coming back to you because your research question is incomplete. So for patient population, you have to define age, genders, type of surgeries, whatever it is. For intervention, it could be drug, technique in any interventions. Comparison, as I mentioned, standard of care or a gold standard or a conventional technique. Sometimes placebo, but placebo does not mean that you not provide standard of care. Outcome could be anything. It could be qualitative or quantitative variables like blood pressure, heart rate, visual analog scale, decrease in the requirement of opiates in the perioperative period, decreasing the duration of surgical procedure, whatever it is. So it should be clearly defined what is the outcome. And it should be the primary outcome preferably. And I repeat again, it should be the single outcome usually. And at what point of time? Immediate, 1 hour, 6 hours, 12 hours, 24 hours, 1 week, 1 month. Specifically depend upon what study, what research you are doing, what research question you have and its relevancy. So this means PICOT is important. You should frame research question fitting the FINER criteria and fitting the PICOT criteria at all the components. And when you have these research question could be of many types. It could be interventions. It could be treatment-based. It could be prognostic-based, diagnostic-based, theology. So depending upon whatever you say, the drug A is better than drug B, technique, lab surgeries is better than robotic surgeries. How will this investigation fare better than the other diagnostic modalities? So on and so forth, the research question will depend upon what clinical problem you are thinking of. Let's see this small example. So in adult patients undergoing elective surgery, does treatment with epidural analgesia in combination with acetaminophen and NSAID, that is multimodal analgesia, compared with epidural alone, lead to better pain relief and less side effects over 24 hours following surgery? Now, this is the research question, which is having PICOT component. So I've tried to just underline those PICOT components into it. So these are the PICOT components which has been included into this. And this is how you have to frame a research question. Similarly, look for its feasibility, apply final criteria. It's feasible, it's interesting, it's novel, it's ethical, it's relevant. Depending upon research question, do look for whether all those parameters are applicable. Now, once you have review of literature, you have clinical problem, you have research question, you frame your aims and objectives clearly. Usually, the objectives are primary versus secondary. The most important one, which will be the primary research question should be your primary objective. You can have many. And then if you think something is directly related to the primary research question, that also needs to be answered. You can have secondary objectives also. But remember, there should be usually one primary research question and maybe 1, 2, or 3 secondary objectives can be added to them. But they should be linked in some way. That is, for example, if there is some new drug and you think that it can cause some complications which are important to know, you can put them into secondary objectives. Now, when you put in objectives, another SMART criteria. So when you have an objective for a particular research question thing, they should be specific, they should be measurable, they should be attainable, relevant, and time frame. So this again should fit into your objectives when you plan your research question and frame your objectives. And then objectives will help you to, when you write the method, you will have to have certain outcome measurements. And again, your primary outcome should be clinically meaningful. It will be sensitive to the effect of treatment, and it will have some beneficial effect on the patient. And also, primary outcome or your primary objective or primary research question will also help you to determine the sample size, which is important again when you conduct a study. Now, when you write a primary outcome, it should be very clear. Like if you say the first one, our primary outcome variable is pain measurement. So this is not correct. It should have all the components. Our primary variable outcome is pain as measured by VAS on a scale of 1 to 100. It should, no, we just mentioned measurable. So it should have, and it should be measured by what. Now, objectives again should be very clear. Like for example, to determine the impact of pregabalin in patients undergoing abdominal surgery. This type of objective is not giving much information to us. So it's not right. So it should be something like this. It's a complete primary objective to determine the analgesic efficacy of a single dose of oral pregabalin as an adjuvant as compared to placebo administered 2 hours prior to surgery in adult patients undergoing laparoscopic surgeries under GA. So it should have a complete objective rather than just saying pregabalin surgery. So this is how you have to write it completely so that you are able to understand. So when you're writing these objectives, you should be following the certain criteria, SMART, final, PICOT, I have just mentioned for you. You need to include them during your management, your initial phase itself so that you are very clear. Once you have everything available, you generate an hypothesis. Hypothesis is just making some inference. It drives the study design and the study objectives. Zinc supplementation in infants born small for gestation age reduced mortality. So you have to define them appropriately in the PICOT format. It should be very, very clear when you state the hypothesis rather than writing a simple statement like this. It should be again very, very clear. This hypothesis will be proven. They are statistical tools. So maybe sometime later we'll discuss about those statistical tools. Now this research question or the primary objective and the primary outcome has to be executed on real time in patients following certain steps. So you need to put those stepwise approach, which is the important section of your protocol and publication methods, where you need to describe everything at how are you going to do that particular study to answer the research question. And it should have a detailed strategies, which is replicable. It should have everything, and this will assure that the hypothesis for the research question that you have generated will be proved or disapproved. You have a study design, you define the study area, you define the study period, You define the patients, subjects, and participants, inclusion criteria, exclusion criteria, mention about the details of the intervention, details of randomization, allocation, concealment, criteria for discontinuation of the intervention in case if something happens, how data will be collected and analysis done. Also define various tools terminologies. For example, if you want to measure blood pressure, you need to define whether it will be an invasive blood pressure versus arterial blood pressure. If you are measuring blood sugar, it should be a blood sugar or a capillary glucometer test or an arterial blood gas analysis, blood sugar. It should be very clear, mentioned into your method section. All the measurements, how, when, and where, because the readings will change. For example, if you want to measure a BP, if a patient walks into your OPD, he will have a little higher BP. So you should be clear that patient will be coming to you, sitting for some time, half an hour, 10 minutes, and then you will measure the blood pressure. So these all parameters should be mentioned in the method section very clearly. If you are using certain scoring systems, certain questionnaires, scores, you should be very clearly mentioning those aspects also. You should also achieve the confidentiality by not sharing the individual patient data to anybody. And you should also receive appropriate clearances, including ethical clearances or sometimes other type of clearances, depending upon what type of study it is, and also the trial registration. You should also disclose that how this sampling would be done in your patients, how randomization and allocation concealment will be done, and then also define it at least in protocol that how you have chosen the sample size and what statistical analysis will be done to test the hypothesis into your patients. And this becomes important for reporting your study. You should be very clear that what type of variables you are using. There are many qualitative versus quantitative variables. It's a big session. We can discuss it sometime later about the statistical tools and analysis. You should also be looking for various analytic tools, and we'll discuss it sometime later. Once you have done it, sometimes you send it for publications. Sometimes, almost you will plan it for publication, and it follows a certain process. You submit, it is reviewed, certain remarks for revisions, goes to the reviewers, they give reviewers remarks, and based on this, the editors take some decision, and decision may be anything, and then it's finally published. So there are certain groups. This is one of the group. You can follow them up for various queries. Usually some of the data related to research publication are shared on this Facebook page. You can follow them up. And thank you so much. I'm sure that today's session has given you the emphasis on two aspects. That is the literature review, how to do it appropriately, and what should be the study design to be selected, and then frame your research question, your objectives, your outcomes, so that you can make a good research question, and then you can make a good, robust method section so that your study is doable. I'm sure that in near future, we can talk something about publications, the data analysis, the interpretation, and so many other things about research question, and those can be also discussed sometime later. Thank you so much, and we are open. Me and Dr. Indu are open for any questions. If you have any, they can be asked to us.
Thank you so much, sir. It was really wonderful. Now we would like to take up certain questions. If you have already typed in the chat box, I'll just read them. Griva Patel has asked, what is the difference between systematic review and meta-analysis?
So systematic review and meta-analysis, when you try to identify certain studies, they require a systematic approach because you have to identify all the published literature for that particular question that you have developed them, and you systematically search, as we have just discussed, all the articles, try to look for the quality of studies in these identified studies which are fitting into your research question or the objective of your systematic review. you try to look for what outcomes they have. Now, these will have certain data, certain outcomes. If you just try to pull them up, because if you have, say, for example, you identify 20 studies, each study will give certain parameters that drug A is better than drug B with certain things, say duration of analgesia, they will have certain numbers attached to them. So interpreting them individually will not give us something meaningful. So if we have some tool, if we can put them into that tool and they give us certain single reading, this becomes important. So I will put it the other way. When you do a randomized controlled trial, and if it has a sample size of 100, you get data for each patient. You have an actual sheet of 100 patients for that outcome, but you will not be able to understand that what is better than what. So you do some static analysis for those 100 patients in that single randomized controlled trial, and you say something that mean standard deviation for this outcome was this in this group and this in this group, which is statistically significant and probably clinical significance. Same is, rather than patients, here we talk about studies. So if we have 20 studies with some parameters, we pull them up, we do apply some statistical tool, and then make some meaningful conclusion that yes, this drug in these 20 randomized controlled trials appears to be favoring some benefit than the other drug or the other intervention. So this is a basic difference. And usually meta-analysis is always preceded by a systematic review, but all systematic review may not require meta-analysis because there are certain requirement to do a meta-analysis. So they may not require meta-analysis. But yes, when we do a meta-analysis, systematic search and data extraction has to be done, which is a part of systematic review.
Thank you, sir. I hope Kripa Patel, this answers your question. So we also have comprehensive schedule of events for the same, like systematic review and meta-analysis difference in the future, in the coming session.
Wonderful.
Yes, sir. So next question is, somebody asked, are the research strings developed by ChatGPT good enough, ma'am? If you want to, like.
Search string by ChatGPT. Actually, I have not used ChatGPT for search string. It should be done with the databases. It will definitely, I don't know how ChatGPT is doing search string, but definitely it is going to link to the PubMed or must be doing, but I will not rely on that. I will not recommend also. You should go for your PubMed or Cochrane or Scopus or MS. That's the only thing. Don't use ChatGPT.
So at this juncture, I will clarify one thing that ChatGPT is emerging. So earlier we used to say Google is a garbage. So ChatGPT will use that garbage. So ChatGPT as of now does not know what is a garbage and what is a non-garbage. So it will review all the literature available on any of the network, any of the servers or whatever it is, and it will give you some outcome. So it may not be appropriate. And we have tried to show you in the literature search that we have to look for a literature which is reliable, which is peer reviewed. And when we say reliable and peer reviewed, that's why we have tried to identify certain search engines which publishes or accepts into the repository only from certain group of journals which are peer reviewed. So they will have more reliability. In Google, if I wish to have something, I will create my own website and I can put anything and everything into it, which nobody knows that whether I am right or wrong. So ChatGPT, as of now, is an important emerging tool, but it has not emerged to that extent that it can create and guide you absolutely a right search string. At this juncture, I will advise each one of you who are listening this today's webinar, please do not use ChatGPT because you will not learn. Unless you learn what is right and wrong, then you can take help of ChatGPT. But first learn the things rightly so that you can interpret that what ChatGPT is doing is right or wrong. So the knowledge, the primary knowledge is required for ChatGPT, for any type of identification of search string or identifying of methodology section. Same thing, if you just give a research question and ask ChatGPT, write a method for me, it will write. But whether it is good or bad, you do not know. So please try to avoid ChatGPT at this point of time because it is many new versions has come up it is able to refine further, but the final responsibility is yours. So don't use ChatGPT as a primary thing. You can use it as a help, as a servant, but not as a honor of you.
Sure, sir. Yes, sir. I'll take then another question. Shamana has asked, what are the minimum studies that must be available or reviewed to write a narrative review?
So narrative review, there is nothing called minimum or maximum number of studies. It all depends upon the, whenever you write a narrative review or a systematic review, your objective should be very clear. It should be a focused objective. It cannot be a very broad objective. So if you put a broad objective, as you were doing into the literature search, if you just put the success rate of endotracheal intubation, the narrative review, techniques and strategies, you will get 2 lakhs of articles, right? Because it's a very, very broad one. But if you want to look for a specific, very focused objective for this, a selected population, say patient with cervical spine fractures, whether the use of video laryngoscopy is improving the outcome or having less mobility at the cervical spine. If you are focusing it, it will have less. So there's nothing called uh, less or right. But at this juncture, because this seminar is for medical students, undergraduates and postgraduates, I would very strongly suggest that please leave the narrative reviews for the experts who have experience in that area, because then only they can interpret it. Because narrative review also includes some personal or interpretation from the knowledge and experience they have. On the other hand, systematic review, most of the things are being captured from the published articles and used statistical, although there will be some interpretation from your side in the discussion section. But at this juncture, I will suggest let the narrative review be written by an expert. So once you have an expertise in certain area, you can go ahead and do a narrative review. There's nothing called the minimum number of articles or maximum number of articles. But yes, we believe that we need to have a narrative review where at least 10 to 20 manuscript in that particular area should be there to make something which is descriptive. If they're single article, then why want to republish it? Because that's already there in a single article. So there should be at least 15, 20 good articles which you can summarize in some way. But leave it for experts who are experts in that area, because it requires a lot of individual interpretation.
Okay, I hope that answers. And so, Dr. Shreya Katoch is questioning, do we need a mentor, professor, or AP for literature review to make it credible? Or is it the same without one?
It all depends upon you. I don't. The youngsters are more smarter than we oldies, but because they have more gray cells and they are more intelligent and they have more access to technology. So I don't say that who needs mentor or not. It all depends upon you how much you have learned it. If you have a good understanding of everything, go ahead and do it. If you don't have, obviously you need a mentor, and that's why there are medical colleges still today. Maybe I do not know. 5 years down the line, you don't need a medical college. You can learn yourself medicine. But if there are medical colleges, if there are NMCs, if there are DNBs who are teaching you, if there are teachers there, I think that for some time mentors needed. At least I think even today, though I'm working luckily as professor, I do have mentors today who is guiding me even today. So I do not know. It's up to you that what you needed. But I need mentors even at this stage to guide me for my future, for my clinical research professional activities. Anindu is one of my mentors.
No, sir, you are my mentor.
Yes.
Okay, very nice, sir. So another question is, what are the resources to learn meta-analysis? I think we can take another session also.
Yes.
Okay, ma'am. Next question is how to get the questionnaire validated so that it can be used for survey-based studies.
So again, the most important aspect of validation of a questionnaire is, again, it requires a robust literature review. So once you have the research question ready, you need to know that what are the important aspects, important questions, important concepts that should be included into that questionnaire. So once you have done the review of literature, you identify certain questions which should be a part of that questionnaire. And then this questionnaire will require some aspect of validity from clarity, from content, and other aspects. So that also needs to be clear. Again, it will require the expert opinion here. So you need to identify certain people who are expert in those areas. Once you have done the review of literature, you have identified all questions, you have framed some preliminary questionnaire, it goes to the experts independently and individually. They will try to validate or comment upon certain aspects, which is usually including some Likert scale, and they talk about the various validity tools. And then when you get them from 5 or 10 experts, you will try to see that everybody is going in the same direction or not. And there are certain statistical tools which will give you certain outcome parameters, kappa statistics and similar things. And then you accordingly, you need to revise it once. It may require once or twice or thrice revisions based on their inputs. And then it should be piloted into the population that you're looking for. And again, based on this, you can look for certain understanding. Because, for example, if you have a questionnaire, you want to get it filled from the patient, experts have done it. But when you see for the patient, they say there are certain technical terms they are not able to understand. You should be looking for those things that it should be absolutely a layman language, which may have missed. You will revise it again, and then it becomes validated. So these are the steps, and there are certain of papers published. One paper is published in Indian Journal of Anesthesia also, at how to validate a questionnaire. So that paper can be downloaded from pre-downloadable from Indian Journal of Anesthesia, and it will give a stepwise approach how to validate a questionnaire. Indu, do you want to add something?
Yes, sir. Almost you have covered all the points. And for questionnaire also, like sometimes mostly we write in English only, but always you have to think what is your study population. If it is patient with Hindi speaking, you have to have one local language also. You have to translate. If you are getting same translate and retranslate English to Hindi, then Hindi to English. It should be similar. We should able to get it same. Sometimes you will translate from English to Hindi, the language and the response will change. That you have to also validate.
Thank you, sir. So also before the session, we have prepared a few questions if nobody would like do that. So I think I would go with that. So I want to ask how to develop a good research question. I think
How to develop a research question. Already covered. I think do follow all the steps. And
Yes.
we talk about the FINA criteria and the PICOT criteria. And when you talk about FINA criteria and PICOT criteria, do have a good review of literature to look for novelty, look for components, look for population. And obviously, a good person, a mentor who is experienced in that area will tell you, because sometimes some of my colleagues or students will come up, sir, can you do a research in this area? I said, this research is already done 20 years back and everything is proven. Why do you want to do it now? So sometimes you need to have people who knows a little bit about those things, that this is a well known, this is nothing new. Because when we are young, a flash of light will come into some of the gray cells of our brain, and we think we have done, wow, something new. But uh, I remember when I was young, a couple of years back, I'm young now also, but at that time I thought that I've done something novel. I wrote it and sent it to a journal, and I said, new technique I have devised, which should be useful for the patient. And then the editor wrote me a letter next morning, and he sent me a paper which was published in 1979, and said, dear Rakesh, this paper is already published in 1979. It was a failure and nothing new into it. So sometimes, again, requires a review of literature or writing a research question. You should not do something which is already proven, which is already discarded, which is already have either the beneficial effect, or it is having that this does not give any benefit, or it has some harms. So these aspects are equally important. And then we have mentioned that PICOT component and FINA criteria needs to be looked for. And when you have a research question, also look for the SMART criteria for objectives and outcomes. Because say if you are doing a study into a medical college and you look for that for tubercular cells, you will do electron microscopy to look for these type of cells and look at. If you don't have electron microscope to look for that outcome, how will you do that study, isn't it? So that's why it may be okay in AIMS because we do have, but it may not be okay with a peripheral medical college. So this study is nothing wrong about it. But is it feasible? No, because you will not be able to do it at your center. I can be doing. So it's feasible at my center, not feasible at a peripheral college where there is no availability of that particular equipment or a diagnostic tool or a machine to measure those things. So this is how you need to think of your best research question and final, pivot, and smart. Just once you have idea into this, put into these words, and again, before and after, again do a good review of literature to look for that everything fits correctly into the.
Yes, sir. Thank you so much, sir. I was really curious to know about this. So now another question we have like previously written. Which databases are free? If we could get some highlight.
In the,
Again, just to tell, I told you, PubMed is free for searching. This is for bibliography. But if you want full text, it depends whether it's coming from PubMed Central or Bookshelf. That will be free, or it is being made available free by publisher. Sometimes it is funded, or sometimes author pays some fees to make it free. Those only will be freely available. Otherwise, it will only show citations or with abstract. Sometimes even abstract is not available. Only title and citation is available. So none of the databases is fully free. It is all mixed.
Yeah, okay. Thank you, ma'am. I think this will be the last question. Mike has asked, what as a UG student we can do to make a career in research?
So I think this is a very important question. There are many vacancies and many posts which are coming up as a researcher. They were quite popular for last many years abroad in US and UK and other European and Australian countries. But now they are emerging from India also. So there are scientists and researcher posts which are available, wherein you can pull it at PhD students and do a lot of research, and you can even be appointed as scientist. Even the big government organization like you must have remembered during the COVID times. So those big researchers were doing a lot of research on those molecules, vaccines, and other things. And there are many centers like ICMR and other where these drugs were manufactured. So they have an important role there also. Even in institutes like AIMS New Delhi, we do have a lot of seats for researchers in the form of scientists at various grades and PhD scholars, and they do a lot of research. Similarly, in the pharmaceutical companies, they can join in their research and development programs. There are R&D manufacturing R&D units at various places in India and abroad. They can join those things also. And if you go abroad, the researchers have many options to get funding from many of the agencies. And once they are attached to certain institutes, they can get a lot of funds and they can do a good amount of research. And I think that is the path of getting a Nobel Prize. So I think start at the right time on the right track. I think some of the GAIMS members may get the Nobel Prize from India also.
ICMR has a STS program actually, short-term studentship, that you can search on site and you can apply actually for the undergraduate. This is for only undergraduates.
Yeah.
Yes, yeah. I've also applied for that for this year.
Okay.
Okay, I think this was very like informative question and answer session. And also, so Himansh is requesting, can you please explain Bergsonian bias and Neyman bias and confounding if you want to take, or he can also
I
repeat.
think this bias and confounders is a big topic.
Yes.
I would suggest that you can keep it a separate session. It's almost half an hour to 45-minute session. How the confounders and bias creep into the study, how during the protocol formation they can be taken care of. If they have been missed, what statistical tool we can apply to balance those things. But in a gross, I will answer it. When we say the bias and confounders, basically, these brings the, I can say this can alter the true outcome of a basic research. Say, for example, uh, I will give you one type of example of a bias. Say, I want to measure the blood pressure. I know this is in the control group. If I'm taking a blood pressure through a sphygmomanometer, I can measure a blood pressure of 5 millimeter above or down, right? So this is I am deliberately introduce a bias. If I am measuring the pain score, ask them, Simran, you are not looking in pain. You are looking so good today. So you are absolutely wonderful. I don't think you have any pain today. So you will say, yes, I'm absolutely right, even after this surgery. But on the other hand, if I want to no, make you painful, I say, Simran, you are looking so down today. Are you in pain? I think it's not looking so good. So I can influence the outcome or the answer of measurement that is being done. So these are various bias. Confounders sometimes is like, for example, I'm just giving one example. So there are many other type of biases that can be crept in. Similarly, when we say confounders, so for example, if somebody wants to do a laryngoscopy, and during a laryngoscopy, they just want to see whether the blood pressure increases or not. And now, if you have certain parameters, certain patient population which will show exaggerated response. Say, for example, a patient who is uncontrolled hypertension. And if we do a laryngoscopy, they will show much higher blood pressure fluctuation than a patient who is normotensive, than a patient who is controlled on medications. So this means there are certain participant-related parameters that can influence your outcome, right, and the exposure. In those situations, you should be carefully excluding those patients. That's why if you see a research, I have used the term exclusion criteria. So those exclusion criteria are indicator that probably they are not fitting or they will affect either the exposure or the outcome in certain ways. And that's why we not to remove them. And that's why they come into exclusion criteria. So that's why, again, it requires a good review of literature that for this exposure and for this outcome, what are the various variables that would have impact on either of them or both of them. And those should be balanced. And sometimes uh, there are biases which we cannot see, which we cannot balance, but there are ways of doing it, and that's why we do randomization. So there are some biases which will creep into the patient population, and we randomize them. We do allocation concealment. So there are many things which during the study design, during the conduct of the study, during the analysis, we try to identify and try to balance these biases and confounders so that our exposure, our outcome is truly indicative of the intervention or the exposure that we are providing to our patients.
Thank you, sir. I think, Himanshi, that answers your question. So it was the last question. Thank you so much, sir.
Right.
I'll just say thank you to everybody. Just read it.
Thank you, everybody. And thank you, GAIMS, for giving us opportunity to be part of this younger team. And I give you all the best for making a good research. And maybe a couple of years back, I wish some of the GAIMS members will receive a Best Researcher Award. Recently, some of the Indians have received Top 2 Researchers Award from India. And I'm sure that GAIMS will be in future receiving these awards and probably some Nobel Prize for
Some of the 2%
excellent
is Dr.
progress.
Rakesh, sir.
Congratulations.
That we should inform, sir.
Thank you. Thank you. And thank you, everybody. Endu, you any last word you want to say?
Thank you, sir. Only last thing, one thing I have missed. I think this is important for all of us. Like when we submit any manuscript to any journal, better you put mesh term. Like what is your research question? You have keywords. You search for mesh term. It will easily get cited. Otherwise, it will take more than 1 year, maybe 6 months to 1 year actually, because mesh term is a lot. It takes time. It's because it's done manually. So this is one advice while submitting the manuscript to any journal. And this was nice session. Thank you for invitation.
Thank you so much, ma'am.
Thank you.
Okay. Thank you all for attending today's Basic Research Methodology workshop organized by GAIMS, RSO. Your participation and engagement have made this event a great success. We extend a heartfelt gratitude to esteemed speakers, Dr. Rakesh Garg, sir, and Dr. Indubala Maurya, ma'am, for sharing their valuable insights and expertise. A special thanks to our National Director, RSO, Dr. Yusra Iftikhar, ma'am, for her leadership and support. benefits of the Games Elite membership, I'll just again want to tell you all that. So we have planned an exclusive series of workshops. This was just the beginning, and there will be many more in the future ahead. We have planned events like meta-analysis and systematic review to enhance your learning and in professional development. So those having Games membership will be have access to those exclusively. So yeah, so it is a less interactive session. Now you can see I'm only saying questions, but if you have membership, you can have live chat with profound speakers also in future. So yeah, we hope you find the session informative and enriching. Please continue to stay connected with Games for much more opportunities. Certificates of attendance will be given if you will have already filled the form. And yeah, thank you once again. We'll look forward to seeing you at the future events. Thank you, Simran Thakur.
Thank you.
Thank you, ma'am. Thank you.
Thank you.